Every day, more than 2,000 people call for help from the East of England Ambulance Service.
It's emergency. What's the address of the emergency, please?
Decisions made in these control rooms can mean the difference between life and death. 999 calls are prioritised in 3 ways. Life-threatening calls like a heart attack should get an 8-minute response. It's up to half an hour for a fracture, while non-emergencies get a 50 to 90-minute response. The report shows over 8,000 people had calls downgraded.
We could be talking an individual not dissimilar to my own father who collapsed, an elderly gentleman, 85 years of age, who collapsed with a stroke, yet waited 3 hours for a response. And, you know, it is really like playing Russian roulette with people's lives.
We didn't follow the right process. We know that, we have learnt from that, and most of these calls that we're talking about were the lower acuity calls, not the life-threatening calls such as the heart attack or stroke.
In December 2013, the service changed the way it dealt with calls, but it was unauthorised. It was reported by a whistleblower. One paramedic says it was dangerous.
The worst case scenario is if they're having a heart attack and they're being denied appropriate care, they could die from that.
Have you ever got to a patient like that and found that they should have been graded higher?
Yes, even though as staff we're encouraged to report that, a lot of the time it doesn't happen.
The ambulance service has been struggling to meet targets. Dr. Anthony Marsh was appointed chief executive a few weeks after the responses were altered, but the health minister thinks he's acted swiftly.
It's the culture that I've been trying to instill in the NHS in my period as a minister. Total transparency, total openness, and a willingness to confront problems and unacceptable practices wherever they are found.
Today's report concludes the Trust needs better training for managers, but it says its whistleblowing procedures are robust. Nikki Fox, BBC Look East.